trying to. All right. All right. So, welcome everyone to those who have been waiting in the lobby and watching me struggle with technology. Welcome to you too. So, my name's Doralynn, and I'm a speech pathologist here at Empower Healthcare. And today, our session is all about connecting through communication, which is something that I work with a lot of people with living with dementia and supporting their carers. And so, we always encourage connecting through communication and encouraging communication. So that's what we'll talk about today. We'll specifically be exploring some practical ways to communicate and connect with people living with dementia. And I'm sure all of you attending in some way or form, whether you're family members, carers, or case managers, you do support someone with dementia, or at least may be supporting someone with dementia in everyday life. So our focus today is all about respectful, person-centered communication strategies that will help someone maintain dignity, connection, and quality of life as they live with dementia. So before we get started, I do want to say that Empower Healthcare, we are a multidisciplinary allied health provider. So we not only have got speech pathology, which I'm here representing today, but we also have a lot of different other services, and we do provide services via telehealth as well. So even if you've got a client who lives remotely, we may be able to support them through our telehealth services. So if you are questioning if someone needs allied health services that we offer, feel free to reach out our office, our community services team, to discuss referral options. So getting right into what we're here for today, this is an overview of what we'll be looking at during this session. Firstly, we'll be talking about why communication matters so much. And it's not just from the point of sharing information, but also for maintaining dignity and identity as well as relationships. And then we will discuss what tends to change in communication when someone lives with dementia. And more importantly, what stays strong, what remains their strengths. And after that, we'll go through some practical strategies. I promise you'll have something to take away to try, not just with people with dementia, but with anyone with communication difficulties. But we will talk about supporting someone to make choices, supporting them during their routines, or simply just being able to connect with them socially. So we'll also talk about looking at some nonverbal cues and nonverbal communication. We may talk about some tools that can support communication, whether at home or in their community. And then we'll finish off with some resources. And there will be time for questions at the end. So do feel free to think of some questions, and you can raise them in the question bar or the chat, and we'll go through them at the end of the session. So diving right into why communication matters. So I'd like you to just think about a time when you had a really good conversation. It could be with a loved one, a colleague, or even a stranger. But think about how you felt, how you were able to connect with that other person. And I reckon most good conversation makes you feel heard and makes you feel valued, like you're respected. And it's the same for people living with dementia as well. Communication is so much more than just the words. It plays a major role in being able to maintain our sense of identity. So that's our voice giving us identity. It helps us reduce frustration or distress because we're able to communicate. We're able to express what makes us feel happy, what makes us feel sad, what makes us feel unsafe. And communication also strengthens relationships with people around us. So when language becomes difficult, which we know can happen with dementia, the feeling of being known, valued, and respected, that still remains. That's something we still want to be able to provide the person living with dementia. And that's something we can continue to contribute to, and that's what we will talk about today. So the main thing we want to discuss about today is that even if words are hard, the feeling of being known and valued remains. And before we dive into what strengths people with dementia have, I want to talk a bit about what is affected in terms of communication when people get diagnosed with dementia or present with dementia symptoms. So dementia does affect the brain. It is a neurological condition, and it affects the brain areas that control memory, language, attention, and problem solving. So this can then impact someone's ability to express information, so talking as well as writing, and also to understand information, so spoken language, understanding a group conversation, and also understanding reading. So all of these can be affected with dementia and the way that it affects our brain.
Sorry, Doralynn.
Yes.
The slide hasn't moved on. Oh, there we go.
Oh, I'm sorry. Did we not see these slides?
No, we do
Oh
now, though.
gosh. Well, this is what I was talking about, and I did want to say that this is our key point that we're trying to, I guess, encourage and ensure that people with dementia, even if their words are hard to be expressed, understood, we want to encourage that feeling of being known and valued. So moving on, these are some common changes we may see for people with dementia. So some common changes are word finding difficulties. And this might be something we can relate to. Like, at least for me, I've got word finding difficulties almost every day. I will be thinking of something and I just can't find the word for it. And I just use a vague word. So I might say, oh, that thing that I did, instead of finding the specific word for this. So it happens to the best of us, but for people with dementia, it happens a lot more frequently. And it does impact the successful manner that they deliver their expressions or their what they're wanting to convey. So the other things that you might notice is that you see a lot of repetition. So they may ask the same question or they might repeat your phrase back to you. They can also lose track of a conversation, especially in group environments or noisy environments. It gets a lot trickier to follow along with the conversation because there's just so many different things happening, and distraction is a big difficulty when people have dementia. So the other thing is that their processing speed is a lot slower as well. And so that adds to managing group and noisy environments. That makes it a lot difficult. But processing speed in the sense that they may take longer to respond. So once you've asked them a question, it may look like they haven't understood you, but actually they just might be processing what you've said and take a bit longer than usual to respond appropriately. They can also take longer to understand instructions. So we'll talk about a few strategies to help with slower processing speeds as well. But the other thing is complex language can make it really difficult for them to understand as well. So instead of giving them one-step instructions, multi-step instructions can be really difficult, or abstract ideas that there's nothing concrete or tangible to tie to. Those are harder to follow along as well. So for family members, for support workers, and as case managers, this can sometimes be very confusing or frustrating for us to be able to understand what choices the person with dementia wants to make or what goals they may want to prioritize when we are trying to have those discussions with them. But it is important to remember that these changes are part of the condition. They're not intentional. And when we understand what their difficulties may be, we can adjust the way that we communicate so that the person has a better chance of succeeding. Now, we've been talking a lot about their difficulties, but I definitely want to bring our attention to their strengths. So people with dementia, as much as they have difficulties, they do have strengths in their communication and other areas as well. So one of it would be long-term memory. So long-term memory is often preserved for quite a long time. A person may clearly remember childhood events or important life milestones, familiar routines. Those type of memories often, especially when they're associated to a strong emotion, they're also very powerful. So emotion is something we want to keep encouraging. So being able to help them feel valued is also enabling them to remember or keep up with that memory as well. That being said, someone may not remember exactly what was said. I don't think most of the times we do either, but they will definitely remember how the interaction made them feel. So that's where the emotional memory is prioritized as well. So social instincts like humor, affection, and the desire to connect with others, that remains. And that's what we want to be able to ensure that they continue feeling like they have a good quality of life because they have a social connection with someone. So as carers and case managers, when we focus on these strengths, we can create more meaningful interactions. So how we can do this is talking about familiar topics. So if you know the person, you can talk about a childhood event or an important life milestone like their wedding, or when they had their first child, for example. You can use photos or objects from the past to support this conversation as well. And if this person is new to you, you can ask them about those things as well. They will be able to recall some life events. And if they aren't able to, that's where the carers and family come in as well. And using photos or objects from the past can help. You want to also engage in activities that the person has always enjoyed. Things like if they used to enjoy puzzles in the past, then that's something you might want to bring back and enable them to use that as a form of communicating with you and creating that social connection with you as well. So all of these matters because we want to ensure that we're maintaining that emotional connection that the person with dementia has, to support their identity, dignity, and quality of life again, so that they feel valued and heard and respected. So these are their strengths, and we want to rely on these and use strategies that enable them to be supported with their challenges. So we're moving on to the conversation partner strategies. And these are some practical strategies that you can use right after this session finishes. They can even help with communicating with someone in like a noisy environment, or someone who is hard of hearing. So they're very universal strategies, but they're also quite specific to people with dementia because of the challenges that we talked about earlier. So these are strategies that you can use in everyday interactions. Firstly, it's about simplifying language. As simple as it sounds, sometimes we don't think about how much information we're really giving in a simple short sentence. Like when you ask someone, what would you like for lunch? It is an open ended question, and it requires the person to, one, understand what you're asking, process it, understand it, and then think of all the options that they have, select the right option, find the right word for it, and then produce it. So that's a lot of steps for someone with communication difficulties. So use short, clear sentences and focus on one idea at a time. So instead of asking, what would you like for lunch? Try offering simple choices like, would you like soup or would you like sandwich? This then reduces the cognitive load that you put on the person with dementia and helps them process a bit quicker, and also makes responding a lot easier. And along that same vein as well, allowing time and being patient. I know we all try to be extra patient, but giving them extra time to process really helps people living with dementia because of that processing speed and the ability to find the right words to use as well. So things like pausing after asking a question rather than repeating it immediately because you haven't heard a response, those can be helpful. I've often paused and I think I've paused enough, and I start talking again, and I hear the other person with dementia starting to respond at that moment. So pause longer than you think you need to. Silence sometimes can be uncomfortable, but it really helps, giving that time to the person with dementia to be able to feel like they can respond by themselves and we're not cutting them off. Because think of a conversation where someone's cut you off multiple times, it's quite frustrating. And same thing for them, they can feel like we're trying to cut them off, that we're not respecting them in that way. So give them time, pause after asking questions. And then we come to nonverbal communication. So communication is not just verbal, as you can tell from the phrase of nonverbal communication. Things like your body language, like your eye contact, your facial expressions, the way that you use your gestures. Like I'm talking through the screen right now, but my hands are moving. Using objects around us, pictures, these can all help reinforce what we're saying, especially when you're talking about something a bit more complex and abstract, um, or even basic, simple things like holding up a cup while asking about tea or coffee. These can help support understanding for the person as well. So use what's around you, use what you have, like your facial expressions, to be able to add to that conversation or communication situation that you're having with the person with dementia. The next few strategies are about distractions and
Sorry,
helping that
Dora,
person.
can you move
Yes.
on the slide, please?
Yep. Can you see that?
Thanks.
Oh, good.
Thanks,
Thank you for
Julie,
letting
for
me.
the prompt.
All right. So number 4 is about minimizing distractions. Background noise can make communication a lot harder, like I was saying before. So when I'm saying background noise, it's not just about a noisy restaurant in when you go out to eat. It could even be things like turning off the television at home because it's running in the background. Um, for us, it might be something that we can choose to eliminate and distract ourselves from and to focus on the conversation. But for people with dementia, that selective attention can be a lot trickier. So turning off the TV, making sure that there's not too many conversations in the background. And this can mean you choose a well lit, quiet space to help improve the quality of those interactions that you're having. Number 5 I've got here is breaking tasks into steps. So earlier I was saying that multi-step commands and instructions can be really tricky. And especially for people with dementia, as it progresses, we do support them quite a bit with giving them verbal instructions and verbal prompts. Things like morning routines like going to the bathroom, brushing your teeth, get ready for bed. Instead of saying all of that in one go, try giving one instruction at a time. Things like, let's go to the bathroom. And then once you're there, you're pausing. Then you say, now we'll brush your teeth. So small steps can make tasks really much more manageable and less overwhelming. Same thing if, say, you're visiting as a case manager and you're asking them lots of questions about their routines, or you're asking them to show you where they do certain things. Give them one instruction at a time, like let's go to your room, and then asking the next question once you're there, rather than sort of overwhelming them with a lot of different information. So again, this goes back to that processing speed and helping them understand and comprehend exactly what we're wanting them to understand and respond to. And I guess the most important of it all is to maintain respect and dignity. They're still an adult, so speaking to them as an adult is really important. Sometimes when we try to simplify instructions and break things into simpler things, we might treat them like they're a child. Um, Things like the change in your pitch of voice, like, when you're talking to a baby or a pet, the pitch in your voice goes up and you talk really animatedly. We don't want to treat them like that. You want to speak to them like the adult they are. You just want to try use these strategies to break things down rather than treating them like a child. So include them in conversations that you're having, even if you're conversing with carer. Include them in the conversations. Try not to talk about them as the third person in the room. They still pick up on information like that, and that can diminish their quality of life as well as feeling respected as well. So small things like using their name, addressing them by their name, their preferred name, maintaining eye contact and acknowledging their responses can definitely help reinforce their sense of dignity. So those are the 6 main strategies that I wanted to talk about that could really help improve how much a person with dementia understands what you're saying, and also encourage them to respond and follow along the conversation. But I do also want to talk a little bit more about nonverbal cues. Um, like I mentioned, not all communication is spoken. Changes in behavior, facial expression, or mood can tell us a lot about how someone is feeling. So, in the same way as I mentioned, nonverbal cues can be provided by us, we also want to be able to recognize the person with dementia's nonverbal cues as well. So, for example, pain may not always be a shout or expressing that, ouch, I'm in pain. It could appear as grimacing, frowning, being restless, groaning, even. So, all of those are non-verbal cues that we want to be able to recognize. And I guess as carers or family members, they may be more prone to recognizing these changes because they see the person with dementia every day. But it's important for us to recognize it as people who are supporting the person living with dementia as well, so that we can understand if they're in a situation with emotional distress because of something that we've asked, or because of our presence, like if they're agitated or withdrawing, or if they've lost interest in previously enjoyed activities. Those are all changes that we may expect and we want to be able to pick up on as well. So that we can support them better, of course, and so that we can modify and adapt what we're doing in that situation to best support the person with dementia. So, noticing the changes of the person's usual behavior can definitely provide important clues. If you do see a sudden change in communication or behavior, it can again signal pain, illness, infection, or any other medical issues. So, it may be that we pick up on those and then we recommend that a medical review is completed. So, it is important to pick up on those changes as early as possible. Um, with people with living with dementia as well, we as speech pathologists can support them with some tools and resources, but there are some other forms of simpler tools and resources that can support communication. And these are, we like to label them or group them as low technology devices, and they're very low cost supports. So because they're low cost and they can be completed by the carers or by case managers as well, they're very effective and quick to put in place as well. And it might look like some of the things on the pictures as you can see on the screen. Hopefully, yes, you're seeing it. So it might look like some of the pictures that you can see. It may be a yes/no card. So a card that you can make with a picture of a tick and then a picture of a cross, that they can point to. The person with dementia can point to that to indicate a good yes or no. Because sometimes as dementia progresses as well, it can get really tricky to get a reliable yes or no response from the person living with dementia. So we want to be able to get a good yes or no so that we know what they want. Like if you're asking them, would you like tea? Then they can just say yes or no rather than asking them tea or coffee even. Providing two choices can sometimes be tricky as well. So yes or no cards can support in those situations. And then you can also have things like choice boards. So if you see the little yellow picture with the words home activities, so choice boards are a compilation of pictures of everyday activities for the person living with dementia. So it could be things like listening to music, going for a walk, watching TV, etc. And these can be personalized, and you can just take pictures or use symbols that the person with dementia recognizes and create a board with those pictures. So it's something easy that can be completed at home independently. But sometimes you may need support from speech pathologists to identify what pictures you put in there, which tasks may be important, and whether the person with dementia recognizes the symbols or do they need actual photographs. So if you're unsure, if you're confused as to what is needed, then we're always here as speech pathologists to help support making those choices and also developing those resources if you need the assistance with that. Sequencing visuals are along the same lines of personalizing it to the person living with dementia as well. We choose specific tasks like washing hands, for example, and break them down into those simple steps and put pictures and simple keywords for the person living with dementia to follow along so that they're able to complete those tasks too as independently as they are able to. And we can create all of these resources alongside the family, alongside case managers, and we are very, very encouraging of you creating those resources that's yourselves as well. The most important resource that will definitely require family support is creating something like a memory book with photos and captions. So things like information about myself, my name, my age, and I put photographs of myself in there. So creating stories of key events like your wedding, having your children, going to school, where you grew up. All of those photos can be put together to compile a memory book. And this can serve as a communication resource. So you can pull it up as a case manager to, or as a family member to talk about those pictures with the person living with dementia. And it encourages that conversation because, like I said earlier, one of their strengths is long term memory. So they will be able to contribute to that conversation, even if it's non-verbally. They will be able to look at the photographs with you, listen to you talking about it, pointing. All of those encourages a sense of identity for the person. So these tools can help provide structured choices and can be conversation starters essentially, but they are low cost, low technology supports. So they can be developed independently or alongside a speech pathologist if required. I've had several clients who have used these low technology supports successfully, especially the memory books. It's really something special to them. I've got clients who pull it out every time I come so that they can show me something new they've added in there. And we talk about that and we work on using communication strategies in those moments. So I definitely have seen really good outcomes from this, and they are really good supports. Sometimes we also tend to pivot to more high technology supports. These can look like, as you can see in the picture here, communication apps, AAC devices. So that stands for alternative and augmentative communication devices, like the tablet you see on the screen. There are lots of different options with technology evolving today to be able to use these devices. Um, and there's also digital memory books. So, like the folder you saw earlier, this you can do a digital version of them. And these are more designed for people who are comfortable with technology. So a speech pathologist has to be involved at this stage to help assess which tools are the most appropriate and also to provide training, not just to the person living with dementia, but to the family to be able to use them effectively with each other so that we can maintain communication and engagement um, at home, in the community, with case managers, with other medical professionals. So we're just wanting to encourage that ongoing sense of identity and dignity as well. So in this case, with high technology, again, you will need a speech pathologist to support, but with low technology supports, you can feel free to go at it independently. There's heaps of resources online. But if you're feeling unsure or a bit confused, always reach out. We'll be able to support you to even develop one on your own. Um, Another support that I think is the most powerful support we can offer someone living with dementia is social connection. Again, communication is a form of enabling connection with each other. So, involving the person with dementia in familiar and meaningful activities can help maintain their well being and engagement. So, this can include listening to music together, gardening, if that's something they enjoy, cooking, if that's something they enjoy, or even just looking through the photo albums like the memory books that I was talking about earlier and talking about their past hobbies and life experiences. So, group activities, and there are lots of groups out there who run dementia based groups. So, there are other people with dementia who gather together, and that can be a good avenue for the person living with dementia to be able to access that social connection, and also for families to meet other family members who support people living with dementia. But these activities, these group and activities that are familiar to the person, often sparks conversation and then helps maintain that sense of identity and belonging that we've been talking about for so long. So, what I do want to say is that when words fail, the key message that we want to take away from today is how we connect. And that's by understanding what the person's normal behavior is and nonverbal cues are so that you can observe those changes and use what's around you, use visuals, photographs, pictures, and your own nonverbal cues like your body language and your facial expressions to support that conversation with the person. So we want to support them in activities that are familiar to them, that are motivating, engage them in routines that sometimes helps motivate them and keep them oriented as well. We want to reminisce with familiar photos or topics because we're supporting their long-term memory, which is a strength. And we want to involve a speech pathologist if we're unsure at any point. So by adjusting how we communicate and by ensuring that we're involving important supports, we encourage the person living with dementia to remain engaged, respected, and valued. And that's what we want to be able to ensure that communication enables for them, which is to feel like they remain connected to the family, to their community. So if anything, these are the key takeaways from today. We want to
Next slide,
focus,
please, Dora.
we want to focus on the um, person with dementia, not just their diagnosis. And we do that by engaging them in all these different conversations that we may be having. Um, and we want to combine both verbal and nonverbal communication. We want to be flexible, we want to be patient. We want to use those tools that we talk about to help make communication easier for them so that they can stay connected. And every small moment of connection matters. And when we use all of these tools and resources to support the person living with dementia as early as we can, we then reduce the sort of care that we have to support them with later on as well. So we're making the most of our resources earlier so that we're planning for the future as well. And I'm trying to move to the next slide. There we go. So that being said, supporting people with dementia early on is something we always recognize and encourage. It is evidence-based to provide the most supports as early as possible. So we're setting them up for success and we're managing their funding wisely as well. And so for that very reason, Empower does run the COPE Dementia program, which is
Sorry,
run
it
by...
didn't move on.
That's okay. There
There
we
we
go.
go. Thank you.
Thank you. That's
We
okay.
like a picture.
I know. Um, all right, there we go. That's the picture for our promo. You may have already seen this. If you haven't, here you go. Feel free to scan the QR code on the page right now. Otherwise, do look it up on our website as well. We do run this program, and they're run by our very professionally trained OTs, and they do offer support to the people living with dementia, but also their caregivers. And they also keep very good communication and ensure that the case managers are also kept in touch and are recommended the most effective way of managing the person living with dementia's situation at home. So feel free to look this up and do reach out if this is something you think your clients may benefit from. If you're unsure, again, just link us up and we can talk you through what the benefits of the program may be. And here are more resources. So there are, like I mentioned, several organizations in Victoria that provide education, support groups, and respite services, but also other states as well. These are Victoria specific. Dementia Australia is nation specific. So feel free to explore those websites and provide them to the families living with dementia so that they can feel supported from all avenues as well. And they do make a significant difference, especially the support groups that I did talk about. So these are resources. Feel free to take down the information, but we do have some time for questions at this time. Do we have any questions? Right. I'm going to stop sharing so that I can have a look. I see the chat. Okay, we had some tech difficulties, I see. All right, I do see something in the Q&A section. I've got a question that says, at what stage do clients get beyond using AAC devices? So am I understanding, what I'm understanding is that when do you start using AAC devices, or is this about when we are beyond the stage, like we aren't able to use AAC devices? I might respond to both. If you're asking about when AAC devices are appropriate, that's as early on honestly. Like I said, because short-term memory can be difficult for people with dementia, we try to introduce anything new as early on so they have time to get familiar to it. It's part of their routines, and they're able to use it reliably in the future. Um, and we during the initial assessments we decide first off whether low technology will be appropriate or we want to explore high technology. I guess the main difference between, or not main, one of the bigger differences between the two of low technology versus high technology is that low technology does not have voice output. It can be quite limiting, whereas high technology devices can support the person living with dementia in quite a few situations. um, so we do tend to introduce it as early on, but I can see that the person who asked the question has just said when dementia is advancing, so when they get beyond the point of AAC being appropriate. That's a really good question. Um, it's I definitely would say it's case by case. You will need a speech pathologist to assess to see if AAC is no longer appropriate, because there's quite a few things that we look at before we say AAC is no longer appropriate. Um, One being attention. So if they aren't able to look at the device, then there's very little chance that they will be able to use the device. But that being said, looking at something and engaging with something can be trained as well. So that's why a speech pathology assessment will be important for us to see if the person living with dementia can be trained to look at the device and engage with it. But if they're at that stage of having difficulty with engagement, and when someone loses the intention or the desire to communicate, sometimes AAC devices can't help with that as well. So if they feel, if we're unable to understand if they are interested in having a conversation, then you would again need a speech pathology assessment to determine that and see if AAC may be appropriate. Sometimes visual challenges are tricky as well to use AAC devices, but there are, like I said, technology is amazing now. So there are devices out there that cater to that and hearing needs as well. So really, a lot of different things can make high tech AAC inappropriate, especially keeping in mind that the population that we're working at may not be the most technology savvy. So that itself can be a barrier, but it definitely requires a case by case assessment to determine if AAC is no longer appropriate. I hope that answered the question. Feel free to ask another question if I did not answer it, or if you would like to know something else, keep those questions coming in. I do have this question here that is asking, what are your recommendations for supporting people who no longer speak English or have a carer that speaks their language? Um, Good question. I have a lot of bilingual clients nowadays, and I don't speak their language. So it is tricky, but not impossible. Um, if English is someone's second language, that's something that they may lose the skills for over time. Um, because again, it's not part of their long-term memory, and that's why they're losing it. It may revert back to their English in it first language is what I'm trying to say. So not English. They may revert back to their first language. And what we can do to support them is try to use more picture-based symbols if we're unable to speak the language. So using the objects, like I said, to refer to something that we're talking about. Because it's not that they sort of forget the English, it's just stored in a place that they can't access, which is why they revert back to their native language. So, in order to support the retrieval of those English words and understanding them, we use objects, we use pictures. Um, we can even use Google Translate if that helps. I've had clients where I've had to use Google Translate for, and it supported the conversation. So thankful for online interpreters. You can use all and above of those strategies, including the ones that we talked about, like simplifying language, um, like trying to break it up into simple English words rather than using something too complex or making it a really complex sentence with grammar. So using keywords in English could also help. But more importantly, I think using objects and pictures could support that conversation. So a choice board, like the one we looked at with all the different activities, sometimes we can modify that to include things like tea, coffee, for the person with dementia to refer to, so that they can still have that conversation with their carer who doesn't speak their language. Are there any other questions or even specific examples that you want to talk about to see if a speech pathology referral would be beneficial?
We have one more slide about the Care Expo, not the Care Expo, sorry, the Care Hub
We do.
demo.
Thank you for
Yeah,
reminding
yeah.
me, Nicole. I'm going to share that. Um, so can you see the slides?
We're just on the Q&A one at the moment.
Perfect. Yeah, there we go. So we do have a new portal that we are trialing at the moment, and there's a webinar that is being run by our CEO, Adam. Feel free to attend it. It's just running next week, next Tuesday. Hop onto our website to register. It's just going to make all of your lives as case managers a lot easier because it's much simpler than the current referral form that we have available. And you'll be able to access your client information much easier to track sort of what we're doing as clinicians with your clients as well. So if you're interested in that, definitely attend the webinar that's running next Tuesday at 12:30 p.m. So really the same time as today, just next Tuesday. All right. Well, if we've got no more questions, we'll probably wrap up here today. I thank you all for attending and thank you for your questions. I hope to see, well, yeah, I do hope to see more of you and working with you to better support your clients. And if you've got any questions as to how we can support not just a speech pathologist, but all the other multidisciplinary services we have, definitely reach out to our team and we can assist you in that way.